Among this year's Ramon Magsaysay Awardees is a doctor who has made huge strides in cancer care in India. We talk about Ravi commitment to pro-poor healthcare and more as he joins us from the Indian city of Silchar. Ravi, good evening.
Good evening. How are you?
I'm good. How are you? And congratulations. First of all, congratulations on this award. What does this mean for you to be one of the Ramon Magsaysay Awardees this year?
I look at the award through two telescopes. One is, it is validation of so many people's efforts. People from the hospital, people in the locality, people outside. So many people have, in different ways, helped us reach out to the community. And this is recognition for that entire human network of people trying to join hands to improve the life of fellow human beings.
Validation,
The
yes.
other thing is, I think it will also help us grow, to reach out to more people as we go along.
Amazing work that you do, Ravi. What made you dedicate your cause to providing cancer care to some of the most vulnerable communities through your facility, the Qatar Cancer Hospital and Research Center?
See, my philosophy about patient care is what I learned at the Cancer Institute in Chennai with Dr. Shanta, who herself was a Magsaysay Awardee many years ago, and Dr. Krishnamurthy. And that is what led us to where we are today. The story of the hospital here in itself is a very inspiring story of how lay people decided to turn a hurdle into an opportunity and started a small cancer facility which has since grown over many years. And so the whole thrust is, as human beings, if we all join hands together, there is nothing that we cannot establish or achieve.
It sure has made an impact on the lives of so many people there. And apart from the lack of finances, what are some factors preventing cancer patients from detecting and treating their condition?
If you had asked me this question a few years ago, 10 years ago, as I said, human resources, economic resources, whole lot of regular things. But today, I think very differently. The most important thing is to win the confidence of the people in the community. Poor people who are tossed around so often, who go from pillar to post. Often when they come late, we end up telling them, oh, you have come very late. They have not come late. They have actually come pretty early, but by the time they reached us, it has been very late. And so to win the trust of the person and the family and to retain it over the years, I think is the biggest challenge. And from the top man, from the director to the doorman of the organization, everybody must be fired with this mission. That is when an activity like this can actually happen. And so that is the second challenge, to motivate our own colleagues day in and day after to continue this and to transmit these values to the next generation and teach them to teach forward in their turn.
Yes, that's very important. Well, while there is no known cure yet for cancer, how can we detect and prevent and treat the condition, especially in the early stages?
So I would like to modify your statement. It is not that there is no cure for cancer. Many cancers are actually curable, especially if we detect them early. The problem is in detecting them late. When we identify them early, in a country like India or probably even the Philippines, screening of the general community is not a feasible option. Screening means examining people who do not have any symptoms to see if they have a disease. But what is realistic and feasible is early detection. Cancers often have, a vast majority of cancers actually have some symptoms a lump in the breast, an ulcer in the mouth that does not heal, bleeding when you pass stools or blood in the urine. There are symptoms which are often ignored by people or by medical personnel who get to see them, and by the time it is detected, it becomes late. And so, education, creating awareness is a very important part of this story. And I'm actually very excited by one of my colleagues, Ravi, who has also won the Ramon Magsaysay. In looking at his model, he's using it for educating kids, but we can also use a similar model for educating adults as well.
Okay, Ravi, hats off to you because you expanded the Qatar Cancer Hospital and Research Center from an institution with limited resources. It turned into a full-service cancer care facility. How did you do that? Can you please share that with us?
So we did not have a roadmap, we didn't have the resources to create a master plan and go by it. But what has happened is the growth has been pretty organic. There was a need. We fulfilled that need, created a process, established a facility, moved on to the next problem. And so several, we didn't have a tumor registry. One of the first things we did was put up a tumor registry. We didn't have a department for pathology. One of the first things we did was put up a department of pathology. And like that, and we were not, when we treat poor people, it does not mean that you deliver substandard care. That is fraud. When we treat poor people, also they require the best of care that is available for anybody. And so, see, in the beginning, we didn't know how to do microvascular anastomosis. So one of my colleagues got trained, and he trained all of us to do microvascular surgery in order to reconstruct after major resections. We were not doing minimal access surgery. Another of my colleagues went elsewhere to one of my colleagues, learned to do minimal access, and came and started the program. So little by little, bit by bit, one small block at a time, we have grown to where we are. And so many people have helped us in this story.
Right. Finally, Ravi, before we let you go, the Philippines' healthcare system is plagued with multiple problems. So what best practices can our hospitals adapt or adopt from your cancer care facility?
So I think the biggest myth in healthcare is that it has to be expensive. It does not have to be expensive. We can use inexpensive tests. We don't have to put 5-star hospitals. We can have basic clean facilities, but without the marble and the paintings and the fountains. We can have many of our staff multitask. We can go in for generic drugs. India is a big producer of generic drugs, and those generic drugs, while being equally effective, reduce the cost of treatment enormously. And then we can also be wise in our choice of treatment. Somebody with an advanced metastatic cancer who is going to die no matter what we do does not need to be put through expensive monoclonals and targeted therapy.
Right.
And all our resources can actually be tailored to the need of the patient and the family. Those curable can be cured. Where life can be extended, life can be extended. Where this is not possible, we can focus on palliative care. Both ends of the spectrum, primary prevention, early detection, and palliative care, are ends of the cancer treatment spectrum, and they are low budget activities, very eminently possible across the globe.
Right. Thank you again so much for your time, Ravi, and congratulations. More power to you. Okay, Dr. Ravi Kanan there, Ramon Magsaysay Awardee.